Hello. Thank you for inviting me to attend your annual general conference virtually. It would be amazing to visit every IFDH country, but not possible with my working life. I'm joining you today from my home in Eastern Canada, from a small island called Cape Breton. Maybe you can visit us at some time. Please allow me to bring congratulations on behalf of the IFDH on the celebration of your association's 30th anniversary. The development and strength of an association is a testimony to the commitment of its members. Your association is very active, with membership in both the European Dental Hygiene Federation and, of course, the International Federation of Dental Hygienists. Being a member of a larger organization brings your association exposure to the variety of cultural and scientific strengths of their fellow professionals. The International Federation of Dental Hygienists is only 36 years old, and so we are both relatively young considering our profession is over 100 years old now. And we have been identifying ourselves over that century and securing our position in oral health. I would like to share with you the mission of our federation. The International Federation of Dental Hygienists is an international nonprofit association uniting dental hygiene organizations. By advancing leadership and collaboration, IFDH is the advocate for the dental hygiene profession globally. The IFDH promotes prevention as a part of a patient's overall health and excellence in dental hygiene education, research, and practice. Professionals do not exist alone. We belong to a collective of equally educated individuals with similar goals and ideals. Our 35 countries, with membership of more than 92,000 dental hygienists, has created a strong global body of such professionals. And we are united in our common cause of promoting oral health and preventing oral disease. Although the board may appear to lead the federation, it is the members, through the House of Delegates representatives, that give direction to the board and allow the board to guide the progression of those goals. For these goals to be achieved, however, it takes all of our members' participation. To this end, the board helps to develop programs to foster excellence in oral health, such as social responsibility awards, which recognize the contributions of our members. The Generation Without Decay, developed by your association, was recognized with one of the 3 social responsibility awards in Ireland just last year. When your members create and deliver such programs, we all achieve our mission. Our programs are designed to address the stated ideals in our mission. Each of these ideals of excellence in education, research, and clinical practice are intertwined as each impacts the other, such as in the International Symposium on Dental Hygiene. Every 2 years, we hold a symposium on dental hygiene that provides a wide range of educational opportunities exposing dental hygienists to the current research being conducted by our members, leading to enhanced clinical care. The professional fulfillment of coming together in a learning and social environment while experiencing the enthusiasm for our career is something you should all enjoy. Our next symposium will be in Seoul, South Korea in July of 2024. So please join me as we celebrate the dental hygienist, the center of oral care. The world of oral health has many facets. So where do we fit? I think the Korean dental hygienists have described it best in their chosen theme for 2024. We are the center of oral care. In our mission, we identify ourselves with prevention. Prevention is the center of oral care. The World Health Organization in 2021 passed a resolution on oral health with a goal to improve oral health by 2030. In their resolution, they state that 20% of our global population carry the burden of 80% of oral disease. There are many contributing factors to this disproportionate situation. Some of these being access to care resulting from geographical challenges, financial inequalities even within affluent countries, and socioeconomic factors that place individuals at high risk for oral disease, just to name a few. Since that time, the World Health Organization has developed a global action plan with input from a number of stakeholders in oral health, including the IFDH. We did collaborate with the European Dental Hygiene Federation on a joint statement to illustrate our support of the resolution and our commitment to being a player in its success. Most healthcare systems still focus on a curative approach rather than prevention. But as dental hygienists, we focus on the prevention of oral disease. Dental hygienists as primary oral health care providers are not established in many countries yet. And the number of dental hygienists in countries where we do exist is in most cases far below the number of dentists. In our joint statement, the IFDH and EDHF call on the WHO member states to be active in the implementation of their strategy and action plans on oral health, to improve oral health globally and reduce inequalities in oral health, to create a significant resource for preventive oral health care. We recommend that the World Health Organization's member states prioritize the training of dental hygienists according to the principles set out in the Common Educational Curriculum for Dental Hygiene. By coming together as prevention-oriented professionals, we can strive to influence and reduce the burden of oral disease. Oral disease prevention and control, oral health promotion, and oral care should be aligned with the primary health care system and integrated in existing and new general health policies and public health programs, as well as in nurseries, schools, workplaces, hospitals, home for the elderly. The list could go on. Professor Richard Watt, the director of the World Health Organization's Collaborating Center for Oral Health Inequalities and Public Health, recently stated that dental hygienists can really take the lead on prevention. There are many opportunities for them to promote and influence oral health policies, individually within their own communities, and also, perhaps more importantly, collectively in their national and international organizations. When Professor Watt was asked if a cross-sectoral collaboration between the oral health workforce and teachers, nurses, and public health workers is necessary for all groups in the population to be reached, as had been stated in the joint statement of the IFDH and EDHF, and if he agreed there is a need for this kind of collaboration if global oral health issues are to be truly addressed, he replied, "Yes, without question. Dental hygienists have not only a clinical role interacting with their patients in dental practices, but also a role in the broader community where they need to better understand what factors influence patients' oral health. The health advocacy role that hygienists play can be really important at the community level and can help facilitate collaboration and oral health promotion between the dental team and other agencies and sectors." It's clear, he said, that there are many different levels at which dental hygienists can become involved in oral health policy change. This provides the opportunity, in his opinion, for a challenging and ultimately rewarding career. I couldn't agree more. As president of the International Federation of Dental Hygienists, I feel possibly our greatest impact can be felt in our influence on oral health policy. Prevention is cost-effective and not as high as the cost of curative treatment of oral diseases and conditions. Evidence-based recommendations of cost-effective preventive interventions need to be recommended and implemented in our national health systems. This is where we can be most effective. By lobbying our governments, working with our local and national health agencies, and creating solutions. Further to this call to action, The IFDH and EDHF encourage their member organizations and individual members as well to inform their national governments and become involved as creators and providers of more efficient, prevention-focused, and sustainable oral health care systems. However, for those not included in a government, national, or private health system, non-government organizations and voluntary work of the oral health professionals might be the temporary solution. We know we are good at this. We celebrate our social responsibility projects every year, and we demonstrate time and again that we can make a difference. Our current social responsibility program is based on a Teach the Teacher theme. We are inviting all of our members to identify and implement an outreach project to teach teachers, healthcare workers, community nurses, parents, how to teach oral health to others. By doing this, we can leave our knowledge with others that can pass it on and continue to influence the oral care in their communities. A pebble in a pond. We will celebrate the top projects together next year in Seoul, so please join us. I mentioned earlier that oral health care has many facets. Well, another area of serious consideration is sustainability. Global warming may not seem directly related to oral health, but as we consider our connection as a consumer of energy, water, and producer of waste, we must address our impact on our planet. The greatest opportunity to address sustainable oral health delivery is through prevention. This is the root of the solution. By advocating for a more robust public oral health care policy, we can reach as many members of the public as possible. Once again, however, for those not being reached by public health initiatives, we find ourselves in the required position of social responsibility outreach to create the environment of education. As the public becomes more aware of daily oral health care practices, oral disease is reduced, and the need for curative care is similarly reduced. The cost of curative care is not simply calculated in the materials used, but we must consider the energy required to provide transportation to an appointment. Once at the facility, there are expenditures of energy for power to compressors, handpieces, the lighting, and the infrastructure of the reception and data collection. If we move down another layer, we uncover the disposables that have been expended, such as bibs, suction tips, gauze. Peel down another layer, and we see the packaging needed to supply the materials used to repair that tooth. Then, all of the energy, the water, packaging, and the waste that's used in sterilization. Consider the number of curative appointments carried out globally every day. And if we were able to reduce that by 50%, what an impact we could have. The subject of sustainability goes further than reducing curative treatment, however. We must also consider the delivery of oral care in a more sustainable manner. Even prevention care can impact our environment if we don't consider the method of delivery. Packaging of products, disposables, and water usage can all be measured. It is important that we strive to provide oral health care in an environmentally conscious approach. We must be committed to improving sustainability without compromising excellence in oral health care. On November 4th, the IFDH will be hosting the third in a series of global oral health summits. During this event, experts in the field of oral health from the IFDH, the World Health Organization, the International Federation of Dentists, the FDI, and chairpersons of social responsibility programs will motivate the attendees to become involved in the pursuit of both the reduction of oral disease and sustainability in the provision of oral health care. Please visit our website for more information. To ensure success of our goals and mission, we must all work together. That is why each member association makes a difference. We are a collective body of like-minded professionals, and our strength is in our numbers. Over 92,000 of us that can make a difference in both oral health and sustainability. When the global dental hygiene community came together in Ireland last year, we celebrated under the theme, "The future is in your hands." We were hearing speakers on the World Health Organization's Global Action Plan and the FDI sustainability initiatives. And as I listened to the presentations and reflected on the many documents and joint statements in response to these, I realized that the future was truly in our hands as dental hygienists. We are the prevention professionals, and to effectively achieve any success in either of these initiatives, a focus of prevention must be applied. The Irish dental hygienists had selected that theme in 2016, 6 years before, with no idea what our professional environment would be experiencing in 2022, but yet it was accurately capturing our position at that time. Further to this, the Korean Dental Hygienists Association had selected in 2013 their theme, "The Dental Hygienist, the Center of Oral Health." Due to global issues, the original date of the International Association on Dental Hygiene in Korea was delayed until 2024, and their original theme, "The Dental Hygienist, the Center of Oral Care," is exactly where we find ourselves today, the center of oral care. I opened my address with our mission. Please allow me to leave you with something further to reflect on, our vision. IFDH is dedicated to enhancing the recognition of the dental hygienist as being the key provider of preventive oral health care worldwide, and ensuring that oral health is integrated as a key aspect of overall health. We can achieve this together as members of the International Federation of Dental Hygienists. Thank you so much for this opportunity to address your gathering, and I wish you a successful and enjoyable conference. Dakujem.